Bartholin's glands, which are known as the greater vestibular glands. Reasonable? There's some lesser vestibular glands, Skene's gland. Reasonable? And the Skene's glands enter just around the external urethral meatus and just in the distal portion of the urethra. Those are Skene's glands. Right now, which is all becoming some big controversy today, and now you hear about females ejaculating. Reasonable, the female ejaculator. All right, that was all. When I was at high school, I never even knew nothing about that. Even coming up to that, I was in my 30s, I never knew nothing about that. Reasonable, no, it's now all what? Big thing. All right, leave it alone. All right, so those are that called Skene's glands. Okay, so you have to deal a lot with it. Reasonable? All right, so you know anything about that, right? All right. Those are Skene's glands. Okay, those are what? Skene's glands. Leave it alone. All right, so Moya. Right, what else do we find in the female pouch? We have nearly accounted for everything. What else is left is there to account for? Go ahead. Right, posterior labial nerves and vessels that are coming from the pudendal. Reasonable, the pudendal, reasonable. All right, the pudendal. And therefore, the back of the arm, the back of the more posterior end of the labia, we expect to be innervated by what? Sacral nerves, isn't that so? S2, reasonable, S2, right? And then perianal skin is what? You wipe what? You sit on S2, you sit on what? S2, right? No, you don't sit on S2, you sit on S3, you stand on what? S1, you walk with S2, you sit on S3, you wipe S4. And then inside there is called S5. And then sometimes you, in contraction of the sphincter around the anal canal, that's called the anal wink. Oh, that's mercy. So we can wink the eye, and there's also something called anal wink. But leave it alone. Reasonable? All madness in here. Very good. Right? And then remember, entering more anteriorly will be the what? Genital branch or genitofemoral, yes, yes. Ilioinguinal nerve, yes, reasonable. And then entering now, going into the skin of the labia majora area there. Okay, so all of those things. And in the male, well, it seems as if you are on the ball with it. Okay, you seem to be on the ball with it. Okay. No. Lastly, okay, so this is the last case now. So we have a man by the name of Mitchell. See how we've been very kind with him? So Mitchell now has this is the last thing on that page. But before I just should ask Mitchell the question, let's look here, Richard. Watch here, Richard. This whole area is what? So we take skin. All right, there's skin, reasonable. I reflect skin. And I come to this boy called the Maximum. Mom one, yeah, very good. That is the what? The gluteus maximus, very good. Then I see here the sciatic nerve. I see here the what? The sacrotuberous ligament, right? And Crystal, Crystal, you're here. Crystal's right here. Oh, just put the forceps here. It's all right, just jump up. Just hold it tight like that. So just want your sweetheart. What you're pressing on is the ischial spine. The what ischial spine? And when look at what we see going around the ischial spine. Pudendal nerve, which you may do a pudendal block, internal pudendal vessels, and the nerve to obturator internus. So the pudendal nerve, internal pudendal nerve vessels, and nerve to obturator internus. Reasonable? All right. So the last question, and we're finished. Who is the attending physician? Mitchell. What is his first name? Brandon. Brandon. His brother, my good friend, John. You know John? Or the nice name. All right, so there it is. So Mitchell, you have now a female patient in front of you, and you're doing an examination. Reasonable? Could be for your finals or wherever. Okay, so the female patient is there, and you have observed she comes and she says that she's coming of complaints of pain in the inguinal region. Reasonable, she won't tell you inguinal region, but she will tell you around here. Reasonable? And then what you have observed is that she has, on examination, she has enlarged medial group of superficial inguinal nerves. They're very enlarged, they're tender, they're painful. Reasonable? So you have a 19-year-old, or let's increase her age. She is 26. Reasonable? And she's on the examination table, and you have observed that, and you can see it visually. Those medial group of superficial inguinal nerves are enlarged. Reasonable? Which is a common thing. So the question we are asking him, Rachel, is where are you going to examine? Right, so where will you examine on this patient? So you know after an examination, because there is maybe some infection, maybe a malignancy, something is what is making these nodes very enlarged. So where are you going to? So Michel is in his official garment, reasonable? He has stethoscope around him and all of that, reasonable? So you put on your what? Examining gloves, reasonable? Very good. Where are you going to examine? Let's list the areas. It's a female. So this is a thing you're going to see all the time. Young female comes in with enlargement. The first thing we're going to examine is skin below the umbilicus. So we go to the very obvious thing. Where we're examining, Rachel? Skin below the umbilicus. So any skin problem there is going to drain to the medial. What is the topic we're discussing now? Very important. Those are the, which are ways okay.
It was what, sir?
It's all gone? Why am I doing this? Because when you go into the exam, many of the answers, a lot of the answers going to be medial to superficial inguinal nodes. Reasonable? The majority of the answers are going to be medial group of superficial inguinal nodes. All right? So the first place you're going to examine, and you're going to have this, is the skin below the umbilicus. Next place you're going to examine. When you look at the skin below the umbilicus, perfect. Next place we want to examine on her. Very important, female external genitalia. So we look at the vulva. Reasonable? So we carefully examine the labia majora, labia minora. You examine within the introitus, within the vestibule of the vagina. You look all in that area. Reasonable? Everything that's in the pudendal cleft, in the vestibule. Then you have to examine the lower portion of the vagina. Reasonable? Just at that little entrance of the external urethral meatus. So when you examine all of her female external genitalia, it's perfect. Nothing is wrong. Next thing, where do you go? So, yes, but tell me the better answer. So tell me the magical answer. You said rectum, so I know where what you're talking about. Not really exactly rectum though. Where?
It looks like it's
Anyone has a little piece of tissue? I just don't want it. A lot of wet water in my mouth. Anyone has a little tissue that can spare me? Just a little piece of tissue, you know. Not the end of the world. Oh, you people are very tight. Don't believe it. Oh, leave it alone. Because if I lock it up with water inside, thank you very much. Because if I lock it up with water, then what? Thank you very much. I appreciate it. Very good. All right, so what did we say? So he said a good answer, and that is he said rectum, but what? He's not exactly on it. So it is what? Anal canal below the pectinate line. It is what? Anal canal below the pectinate line. Reasonable? So you examine the anal canal. There are instruments that you can have that you can examine just below the pectinate line. Reasonable? All right. So you examine her anterior abdominal wall, below the umbilicus, perfect. You do a thorough examination of her female external genitalia, it's perfect. You look at the lower part of the vagina, it's perfect. You look at around that perianal skin, no scars, nothing, opening to the anal canal, just to the level of the pectinate line. How far do you have to push it in? What's the length of the anal canal?
4 centimeters.
Very good, 3.8 to 4 centimeters. So you just have to go just to the entrance. Reason about perianal end, you're going right up. Okay, just to the pectinate line. You don't see the columns of Morgagni. Reasonable, that's at a higher level. That's too far up, okay? So you examine all of that. So, Michelle, when you examine all those areas, that you do many times, then everything is perfect. What are you next going to do? Well, what you're most likely dealing now with is a cancer of the uterus. So pathology of the uterus. Where? In the region of where the uterine tubes join the uterus. So especially in that area there, then the cancer cells will travel along the what? Round ligament of the uterus, and then leads to the area of the, or end of story.